privilege to be here, indeed. My task in the next hour will be to give you a kind of romp through moral philosophy as it, I think, in my portrayal of it will be, has actually formed the foundation of bioethics. Bioethics started historically, one can argue, sometime either in the 50s or the 60s or the 70s, depending on whom you're reading. But it's very clear that it has a philosophical foundation. And I want to trace that foundation, not historically, but conceptually for you today. Some of this will involve some distinctions philosophically in some fundamental distinctions conceptually about ethics itself. And I will try to explain to you what the whole notion of a normative ethical theory is. First of all, normative ethics, philosophically at least, says that we should be careful to note what kind of judgment we're making when we make a moral claim. There are many different types of moral judgments we can make. One, the first large category, is that we make judgments about acts. Acts generally as right or wrong. But there are different versions of right or different degrees of right. One degree is obligatory, and I am deserving of condemnation, moral condemnation, if I do not do my obligation. Another category is that something is morally permissible. So I might say it's all right to do that. That's a moral judgment, but it's not a moral judgment that it's right in the stronger sense of I have an obligation to do it. It's a moral judgment that you would be wrong in condemning me if I didn't do it. It's permissible, or if I did do it. And finally, in this category, there's a conception that philosophers call supererogatory. We might call it heroic or saintly. It's beyond the call of duty. Some acts are exemplary. We praise them when they're done, or we praise the person who does them. But we do not condemn a person if she doesn't do those heroic acts. It would be simply wrong to, in fact, condemn a person who failed to do such an heroic act, or an act that, in this logical categorization, it's called by philosophers supererogatory, that is beyond duty. Now, in addition to that, there's a category called moral rights, and this can get really tricky. When I say I have a moral right to something, I might even say I have a moral right to do that action, even when that action is the wrong thing, or at least when you think it's the wrong thing. I have a moral right to free speech. I also have a legal right in some societies for that. Even when I speak the wrong thing, I might speak a falsehood, I might speak something insulting, but I still might have a moral right to speak it. A moral right means that you are morally wrong if you try to stop me. So I don't have an obligation to exercise my right, but I have a right to act in that way. Now, these are potentially quite confusing different categories, confusing when we get into actual arguments about a moral issue. Abortion, for example. A person we have to be very careful in distinguishing whether we're arguing about whether we have a duty to avoid abortion, or whether we're denying that a person has a right to an abortion, or whether we're saying an abortion isn't the ideally right or heroic thing to do. It might be heroic not to have an abortion, for example, in certain circumstances. We have to be very careful what kind of judgment about moral judgment we're making. Now, normative claims, all of these sorts of normative claims, are not empirical claims. Empirical claims are claims of fact. Now, there are a lot of moral issues that involve claims of fact. There are even some uses of the word ought. You ought to do that, which are empirical uses. If I say you have a legal obligation not to steal what you're tempted to steal in a particular case, I'm observing that as a matter of law, which is a matter of fact in a given society, I could of course be wrong in claiming this, but if I'm right, if I know my facts, I say you ought not to steal. It's a normative judgment, all right, but it's not a morally normative judgment. If what I mean is it's legally wrong for you to steal and you could be punished if you do, or in fact, you ought to be punished. Now, there are other kinds of empirical claims about morality besides legal ones. There are psychological claims. You think it's wrong. 90% of the people in your society think it's wrong. That doesn't mean it is wrong. In observing that we think it's wrong, I am not making a normative judgment. I'm observing that we ourselves are making those moral judgments, and that's an empirical fact, not itself a normative claim. Now, there's a whole science of moral psychology which tries to understand why people make the moral claims they do, for what reasons, but that science is not itself making normative claims about what actually is right and wrong to do. It's making claims about what people think about moral claims and why they think the way they do. That's an empirical matter. Now, philosophers go beyond just trying to do something normative and not empirical. And by the way, applied philosophy needs to do a lot of empirical work, because when you apply any of these moral judgments to a real situation, you got to know what the facts are. But I'm here laying out the normative foundations of bioethics, and then when we get to actually applying them and using them, we of course are going to be involved in a lot of complex empirical perceptions. I don't want to give the impression that good bioethics and making good moral judgments, normative judgments in bioethics, does not need good empirical work. It needs a lot of good empirical work. But it needs not only empirical work. Now, the big sort of theoretical claim here that philosophers have made, and they've had a great deal of influence on bioethics, is that there is something, long tradition in philosophy, in moral philosophy, called normative theory. What is normative theory? It's an attempt to give an explanation of why the acts that are right, assuming that there are some acts that are right. Now, you might be a skeptic and say there are no actions that are right. It's all just opinion. But the search for a normative ethical theory is the search for what would actually make an act right, and in opposite cases, actually make an act wrong. Now, how would you go about constructing a theory? These are some examples of theories, but I want to ask first the question, how do you go about making a theory, seeing a theory, about what makes right acts right? Well, one way would just be to theorize. I abstractly have a conception of what is right, pull some things together, and maybe I can get a theory that way. Another way, however, is to start with convictions we have that we regard as relatively unbudgeable. Now, we hammer away at them, we try to budge them, but if they really are stubborn, if we think that that is some of the, quote, bedrock in our moral convictions, and that any normative theory would have to take account of those things, then if we can come to some kind of overarching theoretical statement about what makes right acts wrong that accords with those, that both accords with them and helps explain why we have those very strong basic beliefs, then maybe that can constitute a justified normative theory. Now, I want to make a little aside here. There are some philosophers who think that the quest for normative moral theory is quixotic, and it will never succeed. But on the other hand, there are many moral philosophers who think there is something that constitutes justified judgment about what is right or wrong, and that there's some way of explaining how those judgments that we make, that are moral judgments that are justified, are the way they are. Now, three large theories here, we might note, are, first of all, a consequentialist theory. This kind of theory says that it's the good or bad states of affairs, the good or bad things that flow from an act that make it right or wrong. I want to take an example of John Stuart Mill, who's a famous utilitarian, himself argued. He argued that child labor was morally wrong. It was morally wrong for a society to permit child labor. It was morally right for a society to ban child labor. His argument was a consequentialist one. Parents might want their child to work before, that is, we're talking about children under 12. Now it's children under 16 maybe, but children under 12 in his day. Parents might need the income that child could gain for the family income, and otherwise the family would be poorer. The child might want to work to help out its family. Now, if both the child wants to work, the employer wants to hire the child, and the parents want the child to work, some people said, well, of course it's right to allow this. And John Stuart Mill said, look at the consequences. You are condemning people generation after generation to not be educated sufficiently to get out of poverty. Now, the consequences he was concerned about were not even the consequences in 10 years in that family. It was also the consequences 20 and 30 and 50 years after maybe 2 generations down the road. But he was absolutely convinced that the consequences of permitting child labor were negative, bad for human beings. And if he could justify the claim that they were bad, that certain things would happen that were bad, then he thought it followed that it was wrong to continue to allow child labor. That's a consequentialist kind of argument. It rests on 2 kinds of claims. First of all, that these consequences will follow, that people will be locked into poverty in their family situation. And the other kind of thing he has to argue is that those consequences are bad. Just do 2 things as a consequentialist in his conception of how it is that we justify moral claims. Now, a very different kind of theory doesn't focus on the consequences, but on the inherent nature of an act. For example, someone might say, well, it's not what you think will follow from the fact that you're breaking your promise. That you think that's good, it could conceivably be good, but darn it all, you promised me, or you promised her, to do this. That's a solemn, sacred promise, and when you break that promise, your act is wrong simply because of its nature of being the breaking of a promise. Now, we'd have to ask ourselves, well, why is breaking a promise wrong? And any theory of the sort that says it's the inherent nature of acts that makes them wrong, not their consequences, would have to explain why promise breaking is inherently wrong. But let's suppose that we can, right now, imagine the kinds of explanations that would be given for that. That you're not treating the person you made the promise to, who was counting on your promise, and who formed a trusting relationship with you of some sort because of that promise, you're now going to just let them down as if it didn't make much of a moral difference that you made the promise? A third kind of theory focuses on whether or not the action is done with good or bad intention. Now we'll see that there's one, maybe even two of the three major kinds of theories that I'll explain in a bit, are of this sort. But we immediately probably want to ask the question, well, wait a minute, what is a bad intention? If you intend to do good when you break a promise, does that make the breaking of a promise right? Don't you have to intend to do things that are already right for the intention to make your act right? So immediately somebody might say, well, intentions don't really make acts substantively right or wrong, but they do make the person who does the action worse or better. Now, maybe that's not the case. Maybe intentions really do make acts themselves right or wrong. But one possibility we might want to keep in mind right away about intentions is that that might not be their role. Their role might be to allow us, to provide us the basis of judging whether a person is right or wrong. And that's different than judging whether the person's act is right or wrong. Because good people can do bad acts, and bad people can do good acts, or can act rightly. I think we all have experiences of that sort. Now, I want to look at two cases briefly here, just to get our wheels turning about what makes an act right. Now, this is not easy stuff. There'll be a lot of dispute about these two cases that I'm going to describe. This is the first one, a request for a placebo. This was actually described to us, or raised to Bonnie Steinbach and me in Thailand in January, when by a physician who said, what do you think about this case or experience that I had this last month? A father was diagnosed with terminal lymphoma. All possible treatments that might work had been tried and did not work. It was quite clear. They had run their course. The physician's prognosis was that this patient would die. Now, exactly when, they didn't know, but there was no prospect, at least anything that they could do, that would enhance the prospect of this person recovering. In that sense, they gave this patient a terminal prognosis. The person was discharged from the hospital, and when he got home, the son reports back to one of the physicians, whom the son wants to give the father a placebo. The son reports the father is saying, "They've given up on me." This, "Please, doctor, prescribe something for my father so that he can retain hope, so that he doesn't believe that you've given up on him." Should we provide the placebo? The placebo will possibly make the father feel better because he will have some hope, but it's a sugar pill. So it's not going to cure his lymphoma. Should you as a physician do what the son wants you to do? Prescribe a sugar pill. Notice, to be effective as a placebo, the father needs to think it's something prescribed by the physician, not just a sugar pill that the son got that get pulled out of a jar and gave him. So the doctor is going to have to pose in some way as prescribing this to the father if it's going to have this effect. Should he do that? Reactions. Should he do it? Should he not do it? If he should do it, why should he do it? If he should not do it, why should he not do it? I know you have some thoughts. Yes?
If I were to start, I think I will ask the doctor to prescribe placebo to his father. Because placebo at least make his father do better. And sometimes we know that placebo certainly can help. Just like someone plays a god in the temple, it will help to reduce the pain or the disease of that illness. Or reduce the illness.
So you think it's okay for the physician to prescribe the placebo here because the doctor can honestly believe, quite accurately perhaps, that there is some distinct possibility that this pill will help. Help in what sense? Just make the father feel better, or help in delaying death a couple of weeks, or?
On two reasons. One is to make his father feel better. Okay, feel better, right? Because his father believes that maybe that's struggle for him. So.
I think okay. I think that over two reasons. For my opinion, the placebo may help his father to feel better because his father believed that there's a drug from the doctor, right? So make him feel better. The other reason, sometimes we know that a placebo can help to reduce maybe to reduce the can help to reduce what to help to reduce the illness. Maybe some help to reduce the disease. Some may never know. Just like someone plays in the temple in front of God. If he or she believes that the God can help me, someone can help. Very strange effect.
That could be actually what could happen in a particular case. But let's suppose the lymphoma is so advanced that there's virtually no chance that the placebo is going to delay death, and it will not diminish the actual physical disruption of the body that is the primary reason why the father is feeling so terrible and suffering. There might be marginal positive effects here.
Yes. Yeah.
And the father will, there's one probably pretty clear positive effect. The father will not feel abandoned anymore. The father, if there's nothing prescribed, feels like the doctors have given up on him. So there's that positive effect. Should we get that benefit, though, by misleading the father? Because isn't it misleading him? Because you're giving a prescription which the father believes is something that medically can help, but in fact, medically, it's not something.
Yeah, you're right. Sometimes, here I don't concern about the willingness of his father. We have to.
Okay. Sure.
Just say, let's say you are give the patient a placebo. Let's just say we don't do that. When the patient asks you to say, what are you prescribing to me? Is that means you're gonna lie to the patient to say, this is something gonna make you feel better?
What is this pill?
Yeah. Well, what is this? But you just told me I've got nothing else left. So now you give me something to say that's gonna make me feel better. I just think if we do prescribe a placebo to the patient, that means more or less you're gonna lie to him, isn't it?
Let's suppose, not all cases would be like this perhaps, but let's suppose that there's a small positive effect for the father of receiving a placebo. But let's also suppose that the only way we can achieve that effect is to deceive the father. So,
or I have another option. Because I'm studying Chinese medicine at the moment. I've studied Western medicine for quite a while. I think you can refer this patient to the Chinese medicine. So you actually You actually, you give him something which is not a placebo, and you didn't give
All
up on him.
possibly effective treatments have been tried.
Oh, okay,
Chinese
okay.
medicine.
I'll still give you some herbs though. There's still some herbs
No, that's
gonna
been
work.
tried too. In Thailand, the real situation probably was that some of the traditional Thai medicine had been tried. Okay, well, yes.
What would the case be doctor did give some medication to their father, but actually that medicine is what the pills had been tried.
Just more of the same thing that didn't
Yeah,
work.
but at least it's a medical treatment, and at least there is a trying that, oh, I can try this. If that fails, I tried anyway, in both sense of the doctor and also the patient. Maybe.
But let's suppose the physician really believes that this is not going to work. We've tried this for 6 months and it hasn't worked. It's not going to work now. We have no evidence that it works that late in its use. Well, you can ruminate about this case, but you can have some real clashes in your mind about whether the positive benefits, and there probably are some positive benefits from the placebo here, to the father and to the son, are sufficient to justify a physician's decision to actually prescribe the placebo, which, if it's going to be effectively prescribed, is going to involve some deception. Second case. I'm going to get to the big moral theories after we get done with these two provocative cases. This is a hypothetical case in the sense that no country has actually done this that I know of, although there has been some coercive taking of organs probably in some countries, especially from prisoners. Leaving that aside, let's just take the case in a society that's free and open, but in which we want to save as many lives as we can, as long as we're not doing something morally terrible to people in the process of saving more lives. And in fact, we've got a scarcity of organs. Each of us, in good health, has 5 vital organs: liver, heart, 2 kidneys, pancreas, that's not even counting pancreas. Lungs, possibly 6 or 7 organs, because 2 halves of the lung, various lung lobes. Livers might even be resections. It's at least 5 vital organs we have that could save somebody in a situation where another organ will not save them because organs are scarce. At least somebody down the line of the waiting list for organ transplantation is not going to get an organ because of our scarcity of supply. So if we can get more organs, by getting organs not just from somebody who's dying, and whose organs are going to go to waste otherwise after their death anyhow, or not just the second kidney, for those very altruistic donors who decide to give up one of their kidneys. But we could get at least 5 vital organs. Now, the odds are, with transplantation effectiveness rates of over 80% for virtually all categories of these transplants, that we would be saving an extra 4 lives if we conscripted people who were otherwise healthy, or at least not at the moment dying, and for their organs. Or maybe we even conscripted people who were dying, but we got the organs before they were dead when they were better organs for transplant with a higher effectiveness rate. That's another version of this with slightly less than 4-to-1 saving rate. Now, most people think we shouldn't do this. But suppose we had a fair lottery in which we didn't just pick you out because we didn't like you as well as we liked other people in the society, but like the lottery for the draft in the United States near the end of the Vietnam War, we had a random selection process. We'd still say to kill a person and use them as a means to save 4 or 5 other people? Really? But the consequentialist in us tends to say, or can get pulled towards saying, but it's 4 or 5 people's lives that are saved. It's real lives here because of the scarcity of organs for transplant. Yes, it's terrible that this person from whom the organs were conscripted lost her life, but look at the 4 other people whose lives were saved. Their children, their spouses, etc. Our convictions are pretty stubborn on this one that we shouldn't do it, I think. Now, you might try to save the case for it by saying, well, suppose we actually, as self-interested people beforehand, thinking about the fact that we might need an organ, agreed to a policy of conscription by random and fair lottery, because then we wouldn't have an organ shortage, and I would have the confidence that if I had organ failure, I would likely, very likely, be saved by a transplant, which I am not confident of now with the organ shortage. So in my own best interest, and many other people in their best interest, are going to vote, let's suppose they do vote, for a policy of fair conscription. Because they think that although they're risking their life in possibly being one of the people conscripted to get by for it, they also have a distinctly better chance of being saved if they do have organ failure, and they don't know whether they're going to be the person conscripted or the person who has organ failure, and they've got a 5 times greater chance of being a person with organ failure who's saved this way than the person who's conscripted. Would it be right under those circumstances? I leave it to you to ruminate on that. Most people in our society would say, no, it would not even be right under those circumstances. If so, why? The 3 big theories that I'll quickly go through. Kant and natural law, the 2nd and 3rd theory, are difficult to understand, but I think utilitarianism, although it has a lot of subtleties, is not so difficult intuitively to understand. First of all, in judging an action, not just in making a judgment about whether a state of affairs is good or bad, but about judging the rightness or wrongness of an action, we pay attention, says the utilitarian, to the reasonably expected consequences. What are they? In the case of the placebo, what are the consequences of prescribing a placebo? We need to be as accurate as possible about what those consequences are going to be. And if in fact we just don't know what the consequences are going to be, we're in a situation where we can't make a moral judgment, says the utilitarian. Where we can see what the consequence, with some reasonable justification, expect what the consequences are going to be. Then we have to take the second step, which is to judge the value of those consequences. And here the utilitarian says it's the utility of those consequences, in those consequences. What's utility? It is the subjective value or satisfaction or happiness or pleasure and avoidance of pain to the people whom the consequences fall on. This seems very modern, it seems very democratic, because it is the consequences for every person affected, each person counting equally. And the goodness or badness of those consequences is determined by the subjective value of that consequence to those people to whom the consequences happen. That is, you can't tell me I'm going to be happy when such and such is going to happen if, in fact, when I get there, I'm not happy. Okay? Fourthly, maximum aggregate value You total up all the consequences and the value to in all the consequences to all the people affected. It is not simply the greatest happiness for the greatest number, because the greatest value might lie in just one or two people who are affected. Take the case of the organs, or take the case of torture. We can take any number of cases where hundreds of thousands of people, for example, may get pleasure out of satisfaction or alleviation of their fear if somebody who's been accused of a murder is convicted and executed. Does their freedom from fear and the satisfaction that they thought a guilty person has now been caught and executed, which can be many, 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 many people, outweigh the negative cost to the person who gets convicted and perhaps executed? Well, it could be that depending on how great the fear is for the 100,000 people in that community, or more, that in fact the greatest happiness lies with the greatest number of people. But the utilitarian here wants to emphasize it is not the greatest number of people gaining compared to the number of people being disadvantaged. It is the actual amount of value for those people. And sometimes the greatest amount of value is in a small number of people who would lose big time, lose hugely, if a lot of people gained a little. The utilitarian says that one must do this calculation, this discernment about the consequences and their value and adding them up to all the realistic options for action in that situation. Giving a placebo, not giving a placebo. Conscripting the organs, not conscripting the organs. You can't just look at one option. And furthermore, you can't just look at two if there's a third, which is a very common mistake people make. They focus on the two options that they thought all along are the only two options, but maybe there's a third. In the placebo case, maybe the third option is for the physician and other caregivers to go to the father's home and actually relate to the father in a way that the father says, I have not been abandoned. Because the big loss to the father, as described by the son, is that he's been abandoned. So thinking about that third option, or fourth or fifth, is sometimes very important. Now this method, and this normative theory, is very empirical, and it's very realistic. John Stuart Mill and Jeremy Bentham, 6 years or so before John Stuart Mill, thought it was so modern in its empirical focus and its subjective value, the value to the people who were going to be affected, and the counting up of everybody counts as one, the democratic element here, that this just was the modern morality. Now, you and I can think up problems for that view. The organ conscription example is one problem for that. Sometimes consequences do not convince us. Good consequences are not convincing to us as a sufficient basis for judging an act as right. Now here's another theory. I call it Kantian ethics. We could just call it the ethics of Immanuel Kant, a philosopher in the late 1800s, one of the great figures for sure in the history of philosophy, not just in ethics, but in other fields as well.
18th century.
I said 1700s, didn't I say? I said 1800s? Oh, no, terrible. Of course. Late 1700s. 18th, that is the 18th century. Kant thought that rightness of an action was not constituted by the instrumental goodness of an act, that is, the acts being an instrument to good consequences. Instead, he thought that an act was inherently wrong by its internal rationality or irrationality. Now, this is a little difficult to get hold of, but intuitively I like to think of Kant as saying that the heart of morality, right and wrong action, is whether what you do can be justified as something that other people should also be allowed to do, thinking they're right at doing it, if you're going to think you're right at doing it. If what you're going to do is right for you to do, then fairness requires that it be right for other people to do if they're in the similar situation doing this same act, especially for the same reasons. Now, he formulated his first version, he called it the categorical imperative, because he thought these absolutely obligated people. It was not just a coincident with whether or not the consequences of their action were good or bad. He formulated this as act always so you can will the maxim of your action to become a universal law of nature. Now that's a mouthful and may appear to be opaque, but it is not all that complicated. I mean, there are subtle complications of this for sure. But a maxim is simply the internal subjective principle of my volition when I'm doing an act. Suppose, to get ahead financially at least that month, I'm going to borrow money with no intention to repay it. I, in fact, probably can't repay it. And if I did repay it, I wouldn't gain much from borrowing the money. I'm in a situation where I think the lender is not going to be able to come after me. So I'm going to borrow money with very little intention, if any intention, to repay it, in fact, with the intention of not repaying it. That's part of the reason why I'm borrowing the money. Now, if everyone were to follow the same maxim, would we have a contradiction, or do we still have a consistent pattern? What would happen if people borrowed money when they thought they could get ahead this way, with no intention whatsoever to repay it? What would happen in the real world? Would there be lenders? Well, the lenders, there might still be lenders, but the lenders would be a lot more strict. And in the world in which lenders were a lot more strict, probably you wouldn't get the loan. So if you think you can simply borrow money with no intention to repay it, and other people who want to get ahead similarly in that months or half a year of their finances, who discern that they could also perhaps get ahead by borrowing money without intending to repay it, went ahead and borrowed money without intending to repay it, let that flow out a little while, and I would no longer have the opportunity of borrowing money without intending to repay it. I couldn't get a loan. The act, when it's universalized, when the maxim of my action becomes a universal law of nature in people with similar incentives and motives, they too do this act. The act crashes. It becomes self-contradictory. I can no longer do that. You see that? Now, Kant thought the same was true for lying. That when you lied, if you're going to effectively lie, that is, get the person you're lying to believe what you say as the truth, even though you know it's not the truth and you want them to but you want them to believe it's the truth. If you do that, will people, and many people have the motivation to lie to avoid embarrassment, for example. For all sorts of reasons, people have motives to lie. Let's take a particular maxim. Lie whenever you want to avoid embarrassment, if you think telling the truth is going to be an utter embarrassment to you. Lying is going to proliferate a lot. Will people believe your attempt to lie effectively to avoid embarrassment? Maybe not. There'll be a lot more skepticism. In fact, if this gets rampant enough, people might stop talking. That's probably a little extreme in prediction. But Kant thought that lying crashes on itself. If you if you universalize the maxim of a typical act of lying, like lie to avoid embarrassment. Now, why do I have to universalize will the maxim of my action to become a universal law if my action is going to be right for me to do? Because I need to be fair to other people. They're people too. Kant himself had another argument for this, but I think a contemporary explanation of the roots of Kant's intuition here would be it's fundamentally a matter of fairness and respect to other people as relative equals to myself. Now, you put this in a second way, and this becomes very important in biomedical ethics. Utilitarianism is very important too, as you can see, because we're always thinking about consequences and long-term consequences and consequences to everybody in the situation. But it's this second version of Kant's imperative that is particularly important. I won't go into why he thought that you could generate the second imperative from the very same reasons that he generated the first imperative. But this is the second imperative. Never treat people merely as means, but always as ends in themselves. If you borrow money from a lender with no intention to repay it, you are simply treating that person as a means to your own gain. You can't be treating that person as an end in herself, because a rational lender would not lend you the money if you had no intention to repay. As rational decision-making agents, we are all ends in ourselves. Therefore, nobody should use us, nobody should use anybody merely as a means to their own or other people's satisfaction. The person who is being used must not be used merely as a means. Now, Kant did not say you can't use people as means. We use people as means all the time. When we, in commerce, we sell them, we call somebody and say, "Will you do something for me?" We use them as means. We use good friends as means. But if they're good friends and we're treating them right, we don't use them merely as means. We're treating them as if they have a say. Now take lying to a patient about her diagnosis in order to reduce her anguish or suffering, parallel to the placebo case. Is that treating her as a rational end in herself? Well, somebody could say, it's not treating her merely as a means to other people's satisfaction. You were treating her as a means to her own reduction in suffering and her own hope. But Kant would likely say, wait a minute, if she's being treated just to reduce her own suffering, we're still not treating her as a rational end in herself if we're deceiving her. You can't treat a person as a rational end in themselves if you deceive them. Because being a rational agent means we want to know the things that we're making decisions about and we're reacting to. Now another theory. Let me go back to Kant. Some have argued that this Kantian view is the foundation of the principle of autonomy in ethics. Some people dispute that. But you can see that the notion of informed consent, that you don't treat a patient without informing them of the necessary things about their treatment. You don't get them into surgery without their consenting to surgery. That is implied pretty directly by treating them as rational ends in themselves, not merely as means for the medical profession having successes in reducing people's suffering. That might be a sufficient utilitarian reason, but it's not sufficient, clearly, for Kant. Now, a third theory here is natural law ethics. This has been dominant in Catholic traditions, but it also has a secular version. Maybe not this precise version, but something somewhat like it. That is, it starts with some observations about what human nature tells us about how we thrive and what makes us thrive when we do thrive. And this tradition, in the particular version that's been part of so-called Thomistic ethics in Roman Catholic tradition, but it goes much wider than that too in certain circles, has said there are basic natural goods, 4 of them typically in this view. Life itself. The human species can't exist. We wouldn't exist as moral subjects whom we're trying to treat in correct ways if it weren't for life. Procreation and child rearing. The next generation doesn't come along, the human species either degrades or goes out of existence if this doesn't happen. Knowledge and reason. Our very capacities are that we want to understand things. We built up large edifices of complex disciplines, and that all represents something deeply natural in human beings, and it ought to be promoted. And finally, people relate to each other. They form bonds, very emotional ones, very constructive ones, and sometimes perhaps not so constructive ones. But without these relationships, human existence would be much deprived. Now here's, in the particular version of Roman Catholic ethics, comes an addition to this theory. You could have this theory just stop with the 4 natural goods and say, promote them. Sometimes you would sacrifice some to promote others. You have to sacrifice one person's life, for example, to save 4 others. It would not be out of the question to do that if you stopped with the 4 natural goods. But the view goes on further to say, never intentionally destroy a natural good. You can fail to promote it, perhaps in certain cases, but you don't destroy a natural good intentionally. As long as no natural goods are intentionally destroyed, we should promote and maximize all of the natural goods realization. Now take a couple of cases that are quite prominent in this view. Abortion. When the life of the mother is at stake, even then, or even when the welfare of other children is at stake, this view says that if we are going to intentionally destroy the fetus, there's some assumptions being made here about the fetus already being a human being, and a human being with moral status that needs to be considered. Very big assumptions, to be sure. Then, even then, when the life of the mother is at stake, you cannot abort the fetus, assuming that aborting the fetus is killing the fetus, and that you are intentionally doing it. You could perhaps remove the fetus, if it's a late-term fetus, and hope that it lives to save the life of the mother. But in certain kinds of situations, that's not possible. And if, in fact, the fetus is going to die and the mother is going to die also, if the fetus is not intentionally killed, then this view says let both die, because one is not permitted to promote the good of one by intentionally destroying the natural good of another. This is an absolutist view. It is clearly not a consequentialist view when you put this principle in. This is the so-called principle of double effect. Never intentionally destroy a natural good. Voluntary euthanasia, physician-assisted suicide, even when they're done for the comfort of the patient, are not permitted because they involve intentional destructions of life, a natural good. Deception about terminal illness is a more complex one. Are we violating the natural good of people being able to reason and think about their own care if we deceive them by depriving them of the information that they're terminally ill? Arguably, maybe we are. In which case, maybe in this ethic, we're obligated to inform patients, but it's a little less clear. Finally, do we just have several big theories like this? Utilitarianism, version of consequentialism, Kantian respect for persons, and natural law, and apply those to bioethical situations? Some people have said the big philosophical arguments between these three theories are not settled. They perhaps will never be settled. So here's what we're going to draw out of all of them. Beecham and Childress, two contemporary bioethicists, wrote this view up in the 1970s, 80s, early 80s. It's called Principlism, and it says, coming out of all these traditions, we should think of 4 principles as guiding normative judgment in bioethics. First, beneficence. We promote a patient's good. Notice we're promoting the patient's good, not everybody's good. Second, non-maleficence. First, do no harm. If you think you can promote a patient's good, but you are risking greatly harming them considerably, you first do no harm. You don't take great risks in harming a person in order to gain the good that you think you might get. Finally, autonomy. Respect persons in their capacity to make their own judgments. Maybe, in fact, if we get some competition between beneficence and non-maleficence, not harming a patient and promoting a patient's good, we should leave it up to the patient, assuming the patient has capacity to make decisions. And finally, justice. This is partly the Kantian notion of fairness, but it also is a wider notion of social justice, that power and benefit should not accrue to a few people in gaining them unfair advantage. It is very important, therefore, in the healthcare profession that the professions discipline themselves so that they don't gain undue power and benefit in relation to patients. This is a romp through biomedical ethics. There are other viewpoints, to be sure, including a very large one that's labeled cultural ethical relativism. Maybe, in fact, these fundamental moral judgments out of which we could get a normative ethical theory vary so much from culture to culture that we could never get anything like universal objectivity about any moral judgment. Well, there's an intermediate view within that which says that some of the views we have in morality, the normative views we have, are cross-cultural, as they really do hold in all cultures. But then the interpretation of those words like respect a person, interpretation of what constitutes a good consequence, et cetera, that varies greatly within cultures. And so we get kind of a melding of some universal applicability of common standards across cultures and a lot of variety added by the cultures themselves. That's a long discussion, but we certainly should be attuned to the possibility that there's going to be differences here. And finally, some additional viewpoints that I haven't dealt with. Virtue ethics, which says that character is the most important moral consideration, not the rightness of a person's specific action. Not the rightness of a person's specific action, but what character or propensity for other behavior is reflected in the action they might do. Example, if we don't tell the truth, maybe the most important thing is the honesty or the dishonesty of the person who doesn't tell the truth. Because that dishonesty is going to go forward in that person's life and behavior. in ways that they may say, oh, I'm only being dishonest and deceiving a person here. I won't do it other times. But if one did it then, isn't it significantly likely that one will do it later? The effect on the person's character. A view called contractualism, which Li Lam has defended mightily in some of his writings and arguments, and then we have many other kinds of religious ethics, all of which get put into the pot of argument in biomedical ethics. We have 20 minutes yet for further for discussion of all this. It's been a lot, and I've gone through a number of things very fast, but I hope I've given you some sense of the basic groundwork that has created the contemporary field of bioethics. Just raise hands, make comments, questions. It can be about some of the theories, it can be about cases, it can be about examples that you think of, and how one would deal with them.
About the example of the 5 people dying, I was just wondering if there are 5 patients all dying of a certain disease.
They all need a transplant.
Yeah, and if they could agree among themselves that, because one is having lung failure, the other one renal failure, and so on, I would think that
We'll draw straws, and one of us will get sacrificed.
Yeah, I mean, if they agree,
each one of them has 4 good organs, yes.
Right.
Not 5, but 4.
right, and if they agree, actually the people I've talked to, except there's one person from the U.S. He disagreed, but then other people I've talked to in Hong Kong, they think that that's something that is permissible.
Do they think it's permissible because it would save lives, or do they think it's fundamentally permissible because people would agree to it?
Well, I think it's it's highly arguable that first of all, it's something that people would agree to hypothetically, and also if they also actually agree to it, I think so. There's also, first of all, there's hypothetical agreement, and secondly, there's actual agreement to certain things. I think that, given those 2 conditions, is rather, there are not many cases that are impermissible.
But
Okay, sure.
Can I add on to that? In certain kinds of situations, like everybody's on a ship or they're stranded or something like that might actually happen. And so why don't we generalize? Why don't we say if it's okay on a sinking ship if we can only support 4 people on the boat, somebody's got to go. It seems like the fairest way would do it. Why don't we? This could be a new job,
But the real cases that have made it up to law, to legal cases in some famous cases, have not been quite like that. They've been the child who was sick and was going to die anyhow, and we killed that child for food, and 3 people or 2 people survived. That's a real case.
But there was no actual agreement in that case.
There's no actual agreement.
The kid didn't agree. There's the famous case called Stevenson.
Stevens v.
yes.
But
the cabin boy.
If you imagine situations where there really is agreement, then will we be able to stop it with just the cases where there's agreement, or will we come to see that, well, there's some cases where we shouldn't give the sick boy who's going to die anyhow a full vote in this situation? He's going to probably die anyhow.
Okay.
But the rest of us can live on the boat. So doesn't the agreement model in certain circumstances become less than agreement of everybody?
But the hypothetical agreement model underdetermines the situation because there are too many possible solutions. One solution point is who's the oldest guy, who's unmarried, and who's the weakest, who's the least socially useful. So I think the actual agreement condition put limits
You're
to,
absolutely right.
and people very often, we all know too well that people would sometimes or even often use a moral argument to pursue their own self-interest.
So, but notice what's happening here, and you do notice what's happening here, Han, but we're trying to massage a case where we want the benefits of consequentialist reasoning in order to save the most lives. We massage it in such a way that we can also respect the opinions and reasoning of every person who's going to be affected by this by them agreeing to this ahead of time. It's their consent. And if we do that, we justify the action of getting these organs, not fundamentally by the fact that they're, or just by the fact that they're going to save more lives. We fundamentally justify it by the fact that they want it. Even the person who's going to end up being sacrificed, although that person doesn't know in advance that they're, or otherwise they wouldn't agree to it. Yes.
Thanks very much. I just wanted to sort of ask your views or what we should do to think about autonomy, or a person, perhaps a patient who's very ill, like perhaps the case that you've said, sort of taking them or considering them as rational decision-making agents, because they are very, very sick, always rational on a sliding scale. So if you're not sick, you're that, and if you are very sick, you go down this sliding scale. How can we resolve that? Because they are very sick. Are they rational?
Let's assume we're strict Kantians, and we think that a patient must be treated, every patient must be treated as an end in herself. And ultimately, it's their decision about how they get treated, as long as, of course, they understand what the realities are. The problem is, the rational decision-making agent, as you noted, sometimes isn't there in the real patient. Bonnie Steinbach's going to deal with this after break considerably.
Nicely done, sir.
Or in the case of children, perhaps.
Children are one case.
Yeah.
Actually, she's not going to do a lot with decision-making capacity, but there's a topic here that we didn't put on the list of the 10 topics for this series. Decision-making capacity. Some people, clearly children, don't have full decision-making capacity, although, you know, a 10-year-old can understand an awful lot. And is it really right for the parent to make the final decision?
Or when
in
the child is
situation?
very, very sick.
And, of course, it's a pretty slippery thing to try to argue that just because people are suffering or depressed or under a lot of pain, that they can't make decisions. The pain is the reality. They're dealing with it. They can think about it. Are we so sure that they've lost their rational decision-making capacity? There's been, I think, a pretty strong movement in the last 4 or 5 decades toward looking at people who might initially appear to be compromised in their decision-making capacity as still having quite a bit of capacity. But of course, we could overdo that. We could think we should let a quite severely demented person who can still express some things and react to some things, we should let them determine a complicated decision about whether or not to have a certain kind of surgery that is going to involve perhaps a very difficult recovery and might get them some extra life. But do we really want to, it seems inappropriate to expect them to make such decisions. These are all the real world situations where, suppose we put a great deal of emphasis on autonomy for fundamentally Kantian reasons, we must respect the patient as an end in herself. But we've got these messy realities there in the situation. A lot of other factors besides the patient might come into play too. Suppose there's a very faithful and loyal family and some family members in that situation. Shouldn't they be able to comment on whether their their mother or their father or who the patient is still, quote, themselves. And, well, we should still ask her. Do not they have an appropriate perception? These are very difficult interpretations to make. Getting clear on some of the principles does not settle what we should do in a particular case, because we've got a lot of different facts at play as well. And remember, normative judgment, moral judgment, can go as awry because we get the facts wrong, as because we're confused about principles or have the wrong principles. So we've got to get the facts, we've got to be very discerning about those facts.
Thank you, Professor. I would like to ask you a question about the difference between ethics and law, because a law case was mentioned just now, and because this is a foundation lecture. I'm very interested because there are cases where sometimes it's good under ethical considerations, but it's illegal. And sometimes something is legal, but then it's not good ethically. So in your experience, what are the guiding principles that would help us to clarify some of these dichotomies? Thank you.
Well, for starters, I think we should never ignore the law for two reasons. We need an orderly society, and sometimes breaking the law endangers an orderly society. Sometimes breaking the law does not endanger an orderly society. It depends on how it's broken and in what circumstances it's broken, I think. But also we need to pay careful and sympathetic attention to the law, because many things in the law, not all, but many things in the law themselves grow out of sound moral convictions. And we might miss some of those if we aren't attending sufficiently clearly to the law. But nonetheless, we can all imagine examples where something that is illegal might be the right thing to do. We all have our favorite cases in the history of humankind where that's the case. We all have our favorite cases in the United States, as the U.S. is, we all have our favorite cases. No matter how patriotic and loyal we are and loving of our country we all have our cases where we know U.S. law went badly wrong. Now, in medical situations, the law says you cannot, in all but 6 states in the United States now, the law says, either 5 or 6, depending on how you count the situation in New Mexico. 5, most careful in our numbers. It is against the law for a physician to assist in a patient's suicide by giving them lethal medication that they themselves take, even if the patient takes it and the physician does not administer it by injection. It is still illegal for the physician to aid, to assist the patient in their own suicide. Now, whether you call that assisted suicide or aid in dying, the arguments about what the appropriate label is, my own view is it's both. It's both aid in dying if the person is terminally ill, and it's a physician-assisted suicide. But in all but 5 states in the United States, it's illegal. The fact that we have some diversity on its legality shows that some people think it's not wrong and should be allowed, and not that it's just not wrong, but that people should have a right to decide in their own case whether it's wrong. That's why we legalize it. And other people think, no, it's either always itself wrong, or, although not always wrong, it creates such dangers of abuse for those who are less advantaged and powerful getting coaxed into their own deaths, so we can get rid of them, etc. We'll be dealing with that in some later talks. I don't know where you wanted to go with your legal question, but it certainly is absolutely incumbent on us to know whether what we're doing is legal or not. Because although it doesn't tell us straight off and finally whether an action is right or wrong, it certainly is morally relevant. Because an act that might be morally right, if it were legal, can become morally wrong when it's illegal, not because per se it's illegal, because the law doesn't determine morality, but breaking the law is itself a morally significant dimension of an act. Right? I mean, I think we...
Yeah, that's very helpful. Yeah, thanks.
Do you find yourself identifying with any of these viewpoints, or do you identify strongly with, oh, well, none of them seems definitive, so I'm going to be a principlist and I'm going to consider my actions in terms of beneficence, non-maleficence, autonomy, and justice without trying to reconcile some of the big theoretical things? It's perfectly acceptable to sort of beg off the ultimate philosophical quest for discerning a normatively right, the normatively correct theory, and say, these are some intermediate rules we're going to use in biomedical ethics. And certainly one of them is respect for patients. And in a culture where patients are very integral to their families, another principle, which often gets shortchanged, I think, in American discussions, is respect for families, although sometimes there's competition between patients and families. Other comments?
Thank you for the lecture. I'm just wondering if you are familiar with the works by Jonathan, I don't know, Haidt or Haidt?
Jonathan Haidt,
yeah,
the
the
moral
writer of the
psychologist.
righteous mind, and
Righteous Mind,
yeah, he
I read
challenged.
it a few years ago, so
Okay,
it's not fresh on
and
my mind.
as a psychologist, he really challenged all those what he called, normative ethics, or like our so-called rational decision. And his arguments that most of the decisions, like particularly like in life, death situation. So a lot of decisions are really irrational, and all those normative things is a way for us to justify the action which has been made already. So I'm just wondering what's your response for his critiques of all those traditional moral philosophers' arguments?
I don't know the book all that well because I haven't taught it. And my standard of whether I understand book well is whether I've either written about it or taught it, and I haven't done that with this book. But for those of you who haven't read the book, it's a very good read by a contemporary moral psychologist. The Righteous Mind, and I can't remember what the subtitle is, but it's basically a warning that there's a paradigm out there, people who make righteous, they don't think of themselves as making self-righteous moral judgments. And they're not making self-righteous moral judgments because they don't think of themselves as better persons in making these judgments, better than others. They're just making them, and with strong opinions, the righteous mind. And how badly they go wrong so frequently, and how inconsistent they often are in holding their very strong convictions. Empirically, I have no expertise in the field. I don't know whether he's right in some of his empirical observations. But just personally, I think he's correct. There's a great danger in perceiving without being really careful, or thinking without being really careful, well, this is right, and somebody else is wrong. We need, and philosophers generally, which I think he shortchanges, are trying to say to anybody who has a righteous moral claim to make, what are the reasons you're making? How do you justify it? We've got another person over here arguing the opposite. Doggone it all, you've got to justify that. Philosophers want us as citizens to do that all the time. I think Haidt is dealing with people whom he's getting this data from in his studies who have not been put to that test. which is all the more reason why we need to do good, careful argument, generally in a society, not just in biomedical ethics. Edith. Yes. Last question.
Yeah, okay. A few months back, we had Peter Singer come talk to us, who is, as everyone knows, a very upfront utilitarianist. And he has very specific views on rights of animals plus rights of humans with diminished capability. My question is, if you take the principlist point of view, which is kind of ad hoc, very pragmatic, how do you address rights of animals and rights of people with, dependent children or adults, people with diminished capability?
Well, autonomy would tend to slide into the background. In those cases, at least the autonomy of a person has diminished, significantly, greatly diminished mental capability. But why should non-maleficence not, first of all, do no harm to this person, and secondly, try to benefit them insofar as we can? And why should justice, trying to see what's fair in a situation in which their lives are placed, those three aren't irrelevant because autonomy has receded in its relevance.
And animals?
Also with animals. Now, Beecham and Childress were formulating these principles not for ethical considerations of treatment of animals, but for biomedical ethics. But if pressed, they might decide to write a book about the principles that could apply to animals as well, and maybe some of what they talk already apply. But that's not what's being proposed in that model. It's a good question.
Can I just follow up on this?
Sure.
And the reason is that, the title of today's, of your lecture is Foundations of Bioethics, but questions such as moral status raised by Edith and also the moral status of our fetuses are actually beyond these foundations. By that I mean, we actually don't just use this foundation and then to deduce and then to deduce a result, but rather those are separate questions.
Yeah,
no?
That's a complicated matter. Moral status of a fetus, maybe we do it in relation to some of the elements in the traditional normative theories. Is any autonomy at stake? What are the interests in terms of the actual subjectively valued consequences? That's what Bonnie Steinbach has put a great deal of emphasis on in her writings on the moral status of fetuses. But she will be speaking to this later. In the meantime, my time is up, and we need to take a...
Well, let's thank Professor